To transform a patient-provider conversation into a structured note, start on the Smart Dictation homepage, choose Patient-Provider Dictation mode, pick the appropriate template, and turn on the microphone before the visit begins so everything is captured in real time. Good morning, Mr. Doe. It's Dr. Smith. How have you been since I saw you last? Morning, doctor. I've been more short of breath these past few weeks, especially when I exert myself. Tell me more about the shortness of breath. When did it start and how far can you go before it shows up? About 3 weeks ago, I noticed it on my walks. After just a few blocks I get winded and have to slow down. Any chest discomfort, pressure, or tightness with that breathing trouble? Yes, there's a mild tightness across my chest when I push myself, but it eases if I rest for a few minutes. Have you had swelling in your legs, trouble lying flat, or waking at night short of breath? No swelling, I sleep fine with one pillow, and I haven't woken up gasping. Any palpitations, or lightheaded spells? No, nothing like that recently. You mentioned calf pain on the phone. Does that show up when you walk? After 2 blocks my calves tighten and feel heavy. I need to stop for a minute before they settle down. Understood. Any other medical issues you've been managing? Well, I've got heart artery blockages, and had stents put in back in 2019. My heartbeat can get fluttery once in a while, and I live with high blood pressure, type 2 diabetes, and high cholesterol. I also had a small stroke about 10 years ago but bounced back without any lasting problems. Thanks for summarizing. Any surgeries besides the stents? Yes, my gallbladder was taken out with a scope in 2012, and I had a right groin hernia repair in 2005. Great. I'd like to examine you. Let's start with your lungs. Please sit up straight while I place the stethoscope. Sure. Deep breath in and out. Brief silence while auscultating posterior fields. Another deep breath in, hold it, and out. Brief silence while auscultating lateral fields. Lungs sound clear, thank you. Now I'm going to listen to your heart. Just breathe normally while I move around. Brief silence while auscultating precordium. I'm hearing your regular rhythm with a few early beats. Nothing unusual for you? Great. Let's confirm your medications. Aspirin 81 mg daily, clopidogrel 75 mg daily, apixaban 5 mg, twice daily. Metoprolol succinate 50 mg, once a day. Lisinopril 10 mg daily, atorvastatin 80 mg at night, and metformin 1000 mg twice daily. Is that everything? That matches my pill organizer? I take them as prescribed. Any side effects from your medicines? No, they've been tolerable. I have your vitals. Weight is still around 260 pounds, and height 5'6", correct? Yes, that hasn't changed. Lab work from last week looks stable. LDL is 68, hemoglobin A1C 6.8, kidney function with creatinine 1.1. That's reassuring. Glad to hear it. Today's EKG shows normal sinus rhythm with a few premature atrial beats, nothing we haven't seen before, and your heart ultrasound still shows the pumping strength a little under normal, about 45%, without any new damage. Okay, that makes sense. The CT scan of your leg arteries shows several narrow spots in the large vessels in both thighs, which is why your calves cramp up when you walk. That explains the leg pain. Here's our plan. I want you scheduled for an urgent nuclear stress test to check for ischemia. We'll also bump your metoprolol succinate to 75 mg daily and monitor your blood pressure and heart rate closely. I can't do that. Should I keep tracking my blood pressure at home? Yes, keep your log, and call if the systolic drops below 100 or you feel dizzy. For the leg circulation, I'll refer you to vascular surgery and enroll you in supervised exercise therapy. We'll continue the aspirin and clopidogrel, and once the vascular team clears it, we'll start cilostazol. Sounds good? Please continue daily weight checks, and stick with the low-sodium diet. Nursing will review heart failure warning signs with you before you leave. I'll make sure to watch my salt and weigh myself every morning. Stay on your dual antiplatelet therapy, apixaban, and high-intensity statin. We'll meet again in 4 weeks, but if the chest tightness worsens, or you have symptoms at rest, call me right away, or head to the emergency department. Understood, doctor? Thank you. Your recorded conversation will be analyzed, and we filter out unnecessary information, and retain only what pertains to medical record keeping. Calculator variables are extracted based on the information provided. Even when the dialogue captures most of the story, issue a cleanup prompt so the note reflects every clinical detail. Use instructions like these for the John Doe visit. Insert physical exam section. Lungs clear to auscultation bilaterally with normal work of breathing. Cardiac exam reveals regular rhythm with occasional premature atrial beats, no murmurs, rubs, or gallops, no lower extremity edema. Distal pulses palpable but diminished. Create a lab results table with columns: test, result, notes. Populate it with LDL cholesterol drawn October 25, 68 mg per deciliter, at goal on high-intensity statin, hemoglobin A1c, 6.8%, stable glycemic control, creatinine, 1.1 mg per deciliter, baseline renal function, at a vitals line noting blood pressure 128/76 mm of mercury and heart rate 72 beats per minute, both recorded in clinic today. Add an investigation section and bullet the cardiac testing. EKG today shows normal sinus rhythm with rare premature atrial contractions and no acute ischemic changes. Echocardiogram from October 20 demonstrates left ventricular ejection fraction 45% with mild anterior wall hypokinesis and no new valvular disease. CT angiogram of the lower extremities reveals multifocal narrowing of both superficial femoral arteries with preserved runoff, correlating with exertional calf discomfort. Update assessment and plan to include reinforced low-sodium diet and daily weights, reviewed anticoagulation precautions, supplied written instructions for the peripheral arterial disease exercise program, documented pending vascular surgery referral, and nuclear stress test scheduling. Noted plan to titrate metoprolol 275 mg daily once dispensed. The update instructions will be incorporated. If it includes calculator variable changes, we will present a new score or stage based on updated variable. Once finalized, you can copy the note using copy button and paste it wherever you want.